Hi, I'm Gloria Lanoux, and I'm posting this video just in case I'm unable to get into the collaborative meeting again this evening. I chose to develop an original therapy technique, and in doing so, I designed an experiment to help discern whether or not that technique might quite possibly relieve inhibitions and facilitate the art of creating. Now, that could be a creative work of art, or it could be creativity that would bring about creative conversation in family therapy, making it easier for family members to communicate with each other. I formulated my original question after pulling in a lot of the material that we've been reading and viewing in the last couple of weeks. So the question was whether or not there was a discernible difference between a work of art created under ordinary circumstances in comparison to a work of art created when the artist was in an altered state of mind. Now you can see how the application of an intervention in which you choose to alter the patient's state of mind somehow would bring up a whole bunch of problems requiring careful consideration. It is not safe, ethical, effective, or feasible to use drugs, electric shock therapy, or alcohol to alter the patient's state of mind and put them into a heightened state of relaxation. So the problem at hand became what is available to us as therapists. After thinking about this for days, from somewhere came the recollection of how, as children, my friends and I would twirl around in the front yard until we became drunk from the activity and fell to the ground laughing uncontrollably. I recognized that this might quite possibly be a safe way of temporarily altering the state of a patient's mind during session. I felt confident that if I closely supervised the patient and helped them into a chair following the twirling, that the danger of sustaining any injury was minimal. Within a couple of days, this experiment was performed during one 60-minute psychotherapeutic session of a 20-year-old female patient. The material required are a large selection of semi-precious stone beads for jewelry making, along with the necessary finishings. Now, this technique could also be performed with an assortment of acrylic or oil paints and canvases, or a large volume of sculpting clay, or perhaps colored pencils and a sketch pad. The choices lend themselves to your judgment. Prior to the start of this session, all of the appropriate consents were signed. The beading wire was pre-selected, cut 20 inches long, and the finishings were applied in advance to the patient being brought into the therapy room. When the patient came in, she was instructed to select the materials of her choosing and string a necklace. The patient was informed that she had 30 minutes in which to create a piece of jewelry and was limited only by the material made available to her. I set a timer, sat at the table, and talked with the patient while she worked. When the 30 minutes were up, the selection of beads was quickly restocked so that it would be identical to the original selection. The patient was then instructed to stand at one end of the conference room and twirl around in a circle for 2 full minutes. At the end of the 2 minutes, I assisted the patient into a chair and once again instructed her that she had 30 minutes in which to choose any of the available materials and string another necklace. Once again, the timer was set and I sat at the table talking with the patient. When the 30-minute period expired, the 2 necklaces were then compared. When I compared the 2 necklaces, I saw the second one as having a lighter, brighter color palette and a variety of sizes, shapes, and textures. My notes showed that the making of the first necklace took the full 30 minutes allotted, and the second necklace was completed in less than 20 minutes. In comparing the 2 of them, I can say with no uncertainty whatsoever that there was a big difference in the necklace that was created initially and the one that was created after the patient participated in an exercise that made her giddy, helped her get outside of her head, and put her into a very temporary altered state of mind. These findings lead me to believe that the technique of twirling, when properly used, can aid in producing more positive therapeutic outcomes. Given the safety of the patient can be provided for, The twirling exercise could be performed during a family session with the intent of increasing effective communication among family members. Plausible applications also exist for use in individual therapy. The twirling exercise could result in lowering levels of anxiety and stress. It also shows potential for increasing relaxation, increasing the creative potential, and producing a very pleasant, safe, yet temporary state of euphoria. Thank you.